Joining us now here to take your calls and questions about dentistry. The number to call is 793-WKTV, 793-WKTV. And if you have any questions, of course, give us a call right away. Meantime, talking about this summer, a lot of the kids are home, and it's probably a good time for moms and dads to take some time to examine the kids. And what can parents do if they're just, blind eye looking at their son or daughter's mouth and looking at their teeth? What do they need to be looking for?
Yeah, that's actually a great idea to do because moms and dads, obviously you want to go to the dentist every 6 months to get your evaluation, but you can look in your child's mouth, and if they're losing teeth, let's say on the left side of the mouth, the right side should follow reasonably quickly after, a month or two. So especially in the area of the eye teeth, the cuspids we call them, many times we see a child that's a little bit older and they should have lost an eye tooth, a primary eye tooth earlier, and they haven't. It becomes impacted. So if mom looks in or dad looks in and they have one reasonably large eye tooth and the other side seems very small, that's something you want to call up the dentist, have him take a peek, maybe take an x-ray.
Okay, sounds good. 793-WKTV, 793-WKTV. We do have a call, so let's go live onto the phone lines there. Go ahead, you're on the air. What's your question?
Hello.
Hi, what's your question?
I want to tell Dr. Furino who I am first.
Okay, go ahead.
I've never been able to get through to you, Dr. Furino. This is Betty Washburn.
Hello, how are you doing, Betty? How are you doing today?
I'm good. How are you?
I'm doing fine. Thanks for calling in, Betty.
Yes, and I just wanted to say happy 30th again, and I hope you're still enjoying it.
Oh, I am. Thank you. Thank you so much.
Were you at the celebration?
Yes.
No, yes.
It was very nice.
Oh, good. Oh, good,
yes,
good,
she
good.
Was.
That was fun. Yeah, it was a good time.
Yeah, that was a fun time. And
that was a surprise for you, too, wasn't it?
Yeah, it really was a surprise.
I mean, you knew it was 30 years.
I knew it was 30 years, yeah. At about 29, I thought 30 would be coming up. But it really was a ton of fun, and a lot of patients that I've seen over the years came in and surprised me, and you were there.
I was there, yes.
This is a ton of fun, and yeah, it seems like yesterday I started, and here we are 30 years later.
Yeah, I was a little kid coming in there. Jill Reel was there, too.
Yes,
so,
yes. All my troublesome patients showed up at the party. And like Betty, some of my newer patients, and she's an adult patient.
Let's talk to that point, because I know we've had a couple calls about that. How old is too old, I suppose, to have orthodontic work done?
There really isn't an age limit. Many patients I'm seeing later that are in their 60s and 70s and even approaching the 80s, they've had problems that have bothered them their entire life. And they come in and they just want something fixed, and we many times do a limited treatment, and it works out really well.
And it makes them happy.
It makes them happy. It's a short duration of time, and it works out well.
Good. You're live on the air. What is your question?
Yes, I'd like to know, when you have your teeth cleaned, are you supposed to get a polish, or is that an option after you have your teeth cleaned?
That that many times is up to the dentist. Typically, though, when you go in, we call it a scaling, and a prophy is when the dentist will go in, scale the teeth, remove all the hard accretions that are on the teeth, and then to polish off any of the plaque that tends to be on the teeth, they do take a prophy cup and clean that up. However, if you have a large amount of accretions, many times they may not have the time allotted, and they may bring you back for a second procedure to do the actual polishing. But in general, they do both.
And now they're doing the thing where it's almost like they're sandblasting your teeth.
Yes, that's
new.
That is new. It's been a little while. It's a Prophy Jet. There are different types of devices that we use, and
I don't like it as much.
Yeah. I'm not wild about it myself, but it's very effective. It is very effective, and it's a personal thing, and you can talk to your dentist about it.
I think I like the taste of the toothpaste things that you use.
Yes,
and that's
exactly.
Why I don't like the...
Yeah, we call that pumice, and it really does. It gives you a much fresher taste in your mouth.
Yeah, it does.
But they both work.
Okay. You're live on the air. What is your question?
Hello?
Hi, what's your question?
Yes, I have a question about pregnant mothers taking fluoride for their babies in the womb. 30 years ago, when I was pregnant, I took fluoride tablets, and both of my children did not have cavities until they were teenagers. My daughter now, a 30-year-old daughter now, is pregnant, and they declined to do that. And I was just wondering, what's the current thinking on that?
Well, I certainly don't want to go against the advice of your obstetrician. However, teeth don't calcify in utero. They actually start calcifying when the child, the permanent dentition, starts calcifying, at about 1 to 3 years of age. The central incisors and the molars start calcifying. So even though these teeth aren't erupting until age of 6, they start calcifying at 1 or 2. So any kind of fluoride that a mom would take while she's pregnant really isn't helping the permanent dentition. Your children without any decay is probably due to good oral hygiene and great brushing each and every day.
Also the fact that we have a lot of fluorides in our water now.
Yeah, we do. Absolutely. Yeah. So you are getting fluoride every time you take a glass of water.
All right. A lot of good questions.
Yes.
All right. Thank you very much.
Thank you.
Thanks for coming in.
Okay, thanks.
And we have more news coming up.